All right, hello, and thank you to Matthew for talking about all the sophisticated science behind the scenes of what we do at Symmetry Dental, because now I get to talk about all the fun stuff and actually present the work that we do in practice. So hopefully you've all enjoyed having your minds blown by Matthew. Now it's time to show you the realities of the outcomes of the dysfunctions Matthew has presented. So every patient I'm about to show you has been seen in the last 12 months with us, and they're not the best treatments or anything like that, the best cases that we have, but why I've chosen them is related to their symptoms. So the symptoms that they are suffering, especially in regards to the relationship they have with regards to sleep and learning disorders, the chronic pain that they can be causing, and the chronic health conditions that the patients have. So unequivocally, every patient in this list, in our opinion, was likely to have their symptoms multiply and worsen with time. So just a simple little intro about myself first, and my passion for this guided growth therapy that I refer to it as started, and it was not simply just by having 4 boys in our family, all in the same industry, but rather all started when I was 5. So my name is Dr. Patrick Ryan. I'm a general dentist studying my master's in sleep medicine. Who I treat all sorts of dental issues. However, I do have a very, very special interest in treating dentofacial orthodontics and orthopedics from an airway-centric perspective. So where my focus is mostly is definitely early intervention therapies in children to both prevent and treat malaligned jaws and teeth. So where this interest stems from starts from my father, who also shares the same passion, who's also a dentist. So much so that he was willing to experiment on all his 5 children. And what I mean by that, he's oral appliances, expanders, wideners, all that sort of thing, whatever you call them. That was how he treated us. And in regards to what I want to show you here, sorry, that's not changing. Sorry. So what I want to show you next is pictures of myself. Which will hopefully come up very soon. As I was one of the most gorgeous 5-year-olds that you'll... just use a keyboard. Just use a keyboard, yeah, it's fine. No. That's right, so I'll keep going. So I was gorgeous, as always. So yeah, so with that, when you see my face, you're like, oh, this is a gorgeous young, rosy cheeks, everything like that. So why did my dad see past those sweet cheeks and think I needed guided growth orthodontics? Where did this come from? And I'm not going to go into the complicated diagnostics. Oh, thank you very much. It's perfect. Yep, gorgeous. All right. I'm not going to go to the complicated diagnostics measurements and everything like that. What I'm going to talk about is actually the symptomology that I have. And I think that is enough to show that something was going wrong in that little face. So under this gorgeous smile is a boy who wet the bed until I was 6, had frequent night terrors, chronic blood noses, would lose my voice if I didn't get 10 hours of sleep a night. I was a chronic mouth breather. I would suffer frequent sore throats, nasal congestion and colds. I was held back in preschool because I struggled to stay awake. Simple as that. And that was compromising my learning and behavior, even when I was having regular naps during the day. I struggled to read aloud and wouldn't be able to focus on breathing, reading and speaking all at the same time. So it sounded like I was gasping for air, and I was. And I also had swollen adenoids and tonsils. So now, what do these issues have anything to do with dentofacial growth? Well, in my case, it had everything to do with dentofacial growth. So the human face provides visible signals that could indicate serious underlying health problems. Not only can these problems in the face be an indication of problems in the rest of the body, but they can also be a determinant of how good we actually look. The habits that can make faces unattractive in our culture are, sadly, the habits that can make bodies unhealthy. Perfect example is I want to reiterate on Matthew's study that I was talking about before, and shout out to Derek Mahoney, the orthodontist who's doing his PhD at the moment, who has done an amazing study with sleep studies on 3,500 subjects with malocclusions, and with the age between 7 and 9 in children. He found that 92% of them had sleep disorder breathing. That is dramatic in regards to a scientific publication. It hasn't been published yet, but it will be soon. So Matthew has outlined the impact functional oral habits have on individuals' health, especially in relation to diet and the bioavailability of nutrients within the body, as well as the overall growth pattern of the face. So I'm not going to go through that again. I am just here to show you what therapy we do, the guided growth therapy, the appliances that we use, and also in regards to the respiratory and myofunctional program. And with that same kind of chart and everything Matthew was talking about, I just want to reiterate very, very quickly and show the compromise, the negative cycle some people can get themselves into. And what we're really referring to is the children. The children can get themselves into. And it's not really the chicken or the egg here. We understand that, you know, as what Matthew said, the function is the critical point. If we're not functioning properly and we're compromising the way we chew, the way we swallow, we end up with the narrow dental arches and underdeveloped jaws. This then leads to compromised airway, sleep disorder breathing. Sleep disorder breathing, less growth hormone, compromised airway, less function of the jaws, everything like that. So it bounces back again to the narrow dental arches. It is a bit of a vicious cycle. The only thing that's really great about this cycle though, is if you turn it back, if you change it back to the positive side of things, it wants to grow properly. It will reinforce itself continuously. And we see that in our children. That is our goal, to get them back on that cycle. That's all we want to do. Get them back to where the genetic potential wanted them to be and let them go from there. So let's start showing you some cases. So the major concern we have here is, of course, you know, the crowded teeth. So left-hand side, you can see we've got the crowded teeth, narrow jaws, everything like that. Now, the bread and butter of orthodontics, of course, is it's just straightening teeth, isn't it? That's the priority for this patient. You know, we want to look at the best we can. But really, that is actually the last priority on my list. And it will make more sense when we come to the end of this. Because what I really want to show is just skip ahead here to the face. So before is on the left, and of course the after is on the right. So as we can see on the left, that is a perfect example of you know, a little bit like the rhesus monkeys. We're getting an elongation of the face, the narrowing of the jaw. She's gorgeous, of course, but we can definitely see there's some unhealthy factors in the face. We've got the venous pooling as well, and even the nose looks slightly bigger, and that's just the jaws being too far back. So what we needed to do is we needed to see this first. As the patient walks in, this is the most important part. We can do all the measurements we can, but we really need to look from this perspective and then realize this is an airway issue. This patient had swollen adenoids and tonsils, did unfortunately have to get the adenoids removed, but it's essential that we get that airway open. We also were chronic mouth breathing from day dot. So this has guided this growth. So what we needed to do is fix those habits. The surgery was done. So the priority then was to make sure that we, go back now, develop the jaws to fit not just the airway, but to fit the tongue, to fit the teeth, and then at the end for the straight teeth to fit in. So you can see our priority, airway is first, TMJ, making sure that jaw joint is nice and healthy. And this patient, you can see on the right-hand side on the top left picture, we've got the crossbite. That was causing dysfunction on that right-hand side joint. So that needed to be corrected. The second one is making sure the arches are wide enough to fit the tongue. And that last priority is always fitting in the teeth and making sure you have a nice smile. Okay. And as you can see, look at that arch on the bottom left. The tongue is not a triangle. It needs the U shape. It needs the broad arch to fit it. Otherwise, the risk is you are prone yourself more into relapsing and the retention failing to hold the arches where they should be. So with that, another case, and you may say on the left-hand side, what's really the problem with this? You could probably just do some bleaching, it'll be fine, everything will look good. But really this is where it can be a bit more eye-opening, because at the moment what I see here is I don't see a major aesthetic issue for this patient in the mouth, okay? I definitely see the lower jaw is definitely set back and we're getting some little bit of crowding on the lower jaw, but really this is a teenage boy, he didn't really care about that. What he cares about is his footy. And what he really cares about is sport and everything like that, as well as I did promise that I wanted to give him a chin. So I'm just going to skip forward again. This is him before on the left-hand side, and this is him on the right after 15 months of therapy. And that included both the appliances and the braces to finish everything off. And look, I wasn't really dealing with a major crowding problem, but with him, where it was, and he was encouraged in this therapy when he really trusted me that I would be able to get him this result. And so what I really want to point out here, and hopefully the point out will work, is the chin. So you can see the little bubble that we're getting here. And to me, this is not a concern. Like, of course, it's a concern aesthetically, but why it's a concern is this is the face of someone who's high risk of getting sleep disorder breathing, potentially has it now, but it's a much greater risk in the future. So this is why we wanted to treat him this way. It's all about developing everything forward. So this is a very similar case, just in a younger patient. And this is where I really like to do my treatment, because the changes you can do here are very dramatic. So we can see on the top left, we've got the venous pooling under the eyes. If I can get that out, yep, under there. And then we've also got the gummy smile. We've also got the narrow buccal dark corridors in the side. And then when we drop down to the bottom left photo, we can see the quite flattening the face. Of course, she's absolutely gorgeous. But as we can see, there's quite a significant amount of change. They don't even look like sisters, these two photos to me. So what I can see here is the Venus pulling's gone away, the broadening of the smile. She's starting to get two adult teeth coming through. But look at what I really like to see is the change in profile. So here we can see that jawline is coming down, and we can see the cheekbones coming forward and really getting that much more full face and that kind of model jawline that, you know, everyone wants. But the reason we want it, yes, it looks good, but coming back to it, it's healthier. Okay, the airway is open. So just to go through, these are just to show some of the functional problems that we have. So with this, where we have a problem here is this patient was a thumb sucker. Okay, the thumb sucking did stop. As soon as you probably played them out, they did stop. But in regards to this, they stopped it without the plate. What I see here is the habits still haven't changed. So you see in this photo on the top right, we got the tongue still thrusting in between the teeth. So that's when the tongue postures in between because it cannot fit on the roof of the mouth. So that jaw is not going to be able to grow functionally. What we really need to do is provide the space for the tongue to actually get up there. That's also going to open up the airway. It's going to provide space for the teeth and therefore allow the teeth to kind of naturally straighten themselves up quite significantly. So no braces have touched this patient, but appliances have in regards to expanders and wideners. So I'm just going to show you a few more that were very similar. Thumb sucking patients. Braces haven't touched this patient either, but where still braces are fantastic, love them, and I would recommend this to the patient, but this patient didn't want to finish off the braces, which I understand. She was very happy, and she was traveling about 4.5 hours to get to us. So with this one, same sort of thing. We can see the priority for this patient is just getting enough space for the, first of all, we've got to get enough space for the teeth. We don't want to have issues with the teeth being impacted and things like that, but we want that airway to be as open as possible. We want that tongue to be able to come forward, and we want that gorgeous broad smile at the end. So another case in an adult. So why, oh, not adult, teenager, sorry. So the reason I wanted to show you this one is because I want to show you you can in certain cases, but in most of the cases, what happens is you grow into this problem. It stays there. It stays around. If the system is still broken, it will continue to grow this way. So for him, it is essential that this system was fixed. Otherwise, I guarantee to him, if he continued to tongue thrust, which is not at the end of this therapy, so firing that tongue between the teeth, it'll open up again. Guarantee it. So the function is so important, and that's the only thing that's going to retain this for a lifetime. So this is for all the physios and everything like that out there, and anyone in the musculoskeletal sphere. Look at that top right photo. Look at his head posture. And I took 20 of these photos because I could replicate, because he was trying to posture his head to compensate for the lower jaw. Lower jaw was shifting to one side because of the underdeveloped upper jaw, and this was resulting in the jaw joint being in dysfunction. And of course, the jaw joint is so close to the vestibulocochlear, the balance system, and that's setting everything off. And I know with physios, I'm sure you see it, compensations on one side of the body slowly works down the rest of the body, and you can have, this can set off the neck, this can set off the back, this can continue down. And likewise from the bottom up as well. So for him, you can see when we go down to that bottom right photo, really look at the symmetry of the face. See how he's balancing out. See it already happening. And this is only start and end of therapy. He will continue this way. He's still, just want to point out, see how we've still got that open bite down the back. He's got a lateral tongue thrust now. We still need to get on top of that, but I'm not going to go into that, but that's very important for his stability. This is just again to show you the change, just to show the symmetry that we're getting back in the face. So we actually put him on the back, on the right path. So again, your concern here with the top left picture will be, oh, those two front teeth, way too out front. And look, I get excited when I see the changes of these straightening as well. But what I actually did with this patient, may be counterintuitive here, but I actually developed their upper jaw further. And the reason that is because that lower jaw was not fitting forward. It needed the space to come forward. If I was to treat in the opposite direction and pull everything back, when we pull that back, where are we pulling it into? We're pulling it into the airway, restricting the tongue further. We're restricting the tongue further, so it's probably likely to drop back. We're pushing the jaw joint back. That is not what we want. So what I actually have to do is actually make this patient a little bit more buck tooth. And you'll see that with the next photos. So you'll see before is on the top left, and this girl is fantastic because I love how she changed her hairstyle every time she came in. But I really see it's almost like a different person in each photo. But you can see those teeth actually almost become more accentuated. She is getting broader, so you can see more teeth down the back. That is definitely the case. But really just take a look at that top left and then look at that bottom right. They don't look like the same person. And there is, I think, about 22 months in between these photos. And at this age, it's a lot easier. It was an appliance in the mouth for about 8 or 9 months full time. And then it's night time after that to bring that lower jaw forward. So in the scheme of things with these similar bites, it's a lot harder even as a teenager. And then often, we have to consider surgery when you're an adult or something like that, because it becomes much more difficult and much more entrained, and the bones are much more flexible at this age. So this is her again with her profile, and you can see she wanted to be in that bottom right photo. That is where genetic potential should have had her, okay? With regards to what I really see here is the lower jaw. Look at that little chin, the first 3 photos that we have before the right, it is sucking back. We've got a very, very tight little swallow habit there, and that's where Matthew is critical. I need him to teach those muscles to give in, otherwise that lower jaw is just going to be pushed straight back. And you can see it's kind of like the face relaxes in the lower right photo. So hopefully now, with all those habits and with very motivated parents, and actually mum's now undertaking the therapy herself, we are getting her back on the right track. So with that, this is a very similar case. And the first thing you say, the teeth, we've got to fix those. Yes, we will get to that, and that is very important, as a lot of these teeth can have social issues for patients and things like that, but that wasn't a really big concern for her. The concern here was, of course, for me, the jaw position and the jaw relationship and the airway. And actually with this patient, before even seeing us in regards to the orthodontic side of things, she actually saw Matthew for the breathing and swallowing training and fixed her snoring just from that alone, which is fantastic. The system was quite repaired, but we still needed to fix the structure, and both are not interdependent. You need to fix both for the healthy smiles. So yeah, great change in the profile here. Before on the left, after on the right. And she's not finished, by the way. We actually have to continue bringing her lower jaw forward. She's still showing quite a significant bit of metal swallow there. So we'll keep treating her as we go through. So next bit. This is just an adult to show you an adult form of therapy. It's not much fun in regards to doing this. But this therapy was, I think, about 16, 17 months. And you'd be thinking, how did we expand that jaw to that size? Did we use some, big contraption or anything like that? Luckily enough for this patient, we use something much smaller, and it's called an alpha appliance, and I'll show you what that looks like. It's just a simple little guy there. Now that pink bit's not the gum, that's just a little pad we use just so it matches the gum, so aesthetics and things like that. But that's a little light wire appliance that is actually stimulated by the tongue. It's a little memory wire. It's very, very clever, and we have an excellent lab that makes all these for us. So yeah, big changes in regards to the arch form, but breathing and swallowing is more critical as an adult than it is for a child. And the reason I say that is because this bone is so used to being that narrow that it will function back much quicker to where it was before. And those habits and everything like that, especially for the patient's just response to the whole therapy, is a lot more emphasized, because the little things you can change as an adult, because your body's not as healthy, it just reacts much better. So just another adult. Look, lower photos definitely almost look like this patient has had a facelift from this therapy. It's fantastic. I cannot take credit for this one. However, this was finished recently by Dr. Robert Waits at Central Dental, and it's, yeah, fantastic. I really love this case. He's done really well. But yeah, that's what we wanted to end in regards to one of the biggest things. Yes, the patient looks healthier and everything like that, but what the patient really loved is he's off his CPAP. So CPAP is the sleep appliance that you wear that blows air into the throat to ensure that we keep the airway open. So he does not wear that anymore. So with that, this is one of my final cases. So this patient was one that we saw when she was young. I didn't have any treatment, was a thumb sucker, but didn't get out of the thumb sucking habit. So continued the functional problem. So grew into it. And you may say, look, she's still got straight teeth. What's the issue? She can't bite in the front teeth, but she can chew on the back ones, and that's where we really chew our food. What's the big problem here? Now, the top left photo, she looks quite strained in her smile. It almost looks like it kind of hurts a little bit to smile. The big thing for her was she was actually suffering a number of symptoms. And we have a little video. I may not have time to show it. Oh, you do? We do? Yeah. So this it's great. This little video, I'm going to do this a lot more. It's the first time I've actually done this. So with this patient, sorry, I lost my train of thought. So with this patient, the symptoms that they were getting were migraines, headaches, sleep issues, and the list goes on and on and on. So with this is the priority for her. And what I plan to do for her is help her as much as I can with regards to how the dentofacial growth is affecting that, and hopefully, really guide her back onto the correct track. It is a little bit harder now that she's older, but the big thing is that, we can help her here, and there's a lot we can do. And I would really like to, when you watch the video, she talks a lot about the problems in the past tense, and she's only had the plate in for 1 week. We haven't even started turning the plate. There's no expansion, nothing like that. And all I've really done is just started to reposture the lower jaw. So that was that. And I'll show you that at the end, but hopefully from what we've discussed, I just really want to show you this. She's a gorgeous little girl, okay? And we think she's gorgeous as well, but if we were to go back 300 years, probably most people would say, oh, what's wrong? This is not normal to look at this, but this is becoming normal. I don't want to take away that she's gorgeous, but she will be in my chair in 4 years' time. She will be in the chair because I know with that tongue thrust, that low tongue posture, you can see the narrowness of the upper jaw, the lack of primate spacing, which is just a fancy word to say no spacing between the baby teeth. There are going to be some sleep issues here for this child, airway issues, tongue posture issues, and therefore the jaw function and therefore the growth of the jaw will be compromised. So with that, I'll show you this little video and we'll... Oh, that's the star patient. I'll show you that in a second.
Just tap with the top button.
The top?
Yeah.
Sorry.
It might be I don't think it's going to work.
Don't think it's right? That's right.
Play button.
No.
Okay.
No, that's all good. Anyway, and of course, the star of today really is Ashley. So a fantastic patient, also had a little garter growth appliance in her jaw as well. And this is 4 months before and after. So you can see the changes there. So with all that, thank you very much and hope you enjoyed it.